Hi everyone, future nurses. So for today we discuss about the last discussion for our semifinals, which is documentations and reporting. Okay, so at the end of our discussions, every one of you has the list measure used to maintain confidentiality and security of the computerized client records. Also, we discuss here the purpose of the client's record, compare and contrast the different documentation methods, and explain how various forms in the client's record are used to document steps of the nursing process, discuss the guidelines for effective recording that meet the legal and ethical standards, identify essential guidelines for reporting client data. So these are the learning outcome at the end of our discussions. Okay, so effective communications among healthcare professionals is a vital for our client care. So generally, health personnel communications or communicate through the discussions, reports, and records. So when we say discussion, that is the informal oral consideration of subject by two or more health care personnel to identify a problem or establish strategies to resolve a problem. While in a report, that is a oral, written, or computer-based communication intended to convey information for others or to others. So for instance, nurses always report on the clients at the end of the hospital worksheet. And we have also record. When we say record, that is a chart or client record is a formal. It's also a legal document that provides evidence of the client's care and can be written or it can be computer-based. Although healthcare organizations use different systems and forms for documentations, all clients' record have similar informations. So healthcare analysis informations from record may assist. Documentations. When we say documentations, that is the process of making an entry on a client record is called recording, charting, or documenting. So each healthcare organizations has a policies about recording and reporting clients' data, and each nurse is accountable for practicing according to this standard. So in documentations also, that is a nursing action that produces written account for pertinent patients' data, nursing clinical decisions and interventions, and patients' responses in the health record. So meaning to say that is for documentations, or in short, sabi ko nga kanina, that is the process of making an entry on a client's record. Next one, these are the purposes of the medical record. We have the communications, the planning client care, the legal documentations, reimbursement, auditing and monitoring, research, educations, healthcare analysis, and documentation system. So in communications, clients' records are kept for a number of purposes, including the communications. Because when we say communications, that is the records serve as the vehicle which different health professionals who interact with a client communicate with each other. So this prevents fragmentations or repetitions and delay in a client care. Planning client care. In planning client care, each health professional use data from the client's record to plan of care for that client. So nurses use baseline and ongoing data to evaluate the effectiveness of the nursing care plan. So, di ba, sinabi ko sa inyo before, pinag-aralan natin or pinag-usapan natin yung nursing care plan. So, dito, this is a part of our planning client care. And then we have the legal documentations. When we say legal documentations, that is the client's record is a legal document and is usually admissible in a court as a evidence. While in the reimbursement, that is a documentations also help a facility receive reimbursement from the federal government. So for a facility to obtain payment through Medicare, the client's clinical record must contain the correct diagnosis, related group codes, and reveal the appropriate care being given. While in auditing and monitoring, that is an audit is a review of a client's records for the quality assurance purposes. Okay? Another purposes of medical record is the research. When we say research, that is the information contained in a client's record, or that is the information contained in a record can be valuable sources of data for research. The treatment plans for a number of clients with the same health problems can yield informations helpful in treating other clients. In education, students in health disciplines often use client records as educational tools. A record can frequently provide a comprehensive view of the clients, the illness, effective treatment strategies, and factors that affect the outcome of the illness. And then when we say healthcare analysis, that is information from records may assist healthcare planners to identify agency needs such as overutilized and underutilized hospital records. Records can be used to establish the cost of the various services and to identify those services that cost the agency money and those generated the revenue. And lastly, documentation systems. In a documentation system, that is a number of systems are in a current use. So the source-oriented record, the problem-oriented medical records, the problems, the interventions, and the evaluation model. So these are the purposes of the medical record. Ethical considerations, palagi nating isipin in terms of documentations, we have the privacy and then the confidentiality. So, self-explanatory na yan mga anak. So, alam na natin pag sinabi natin privacy, we have the Data Privacy Act and then the confidentiality. So, pag pinag-usapan natin ang documentations and reporting, it should be kept within the healthcare team or kung sino man yung mga team na nakahawak doon sa ating mga pasyente. And we have the guidelines for our quality documentations. It should be factual, tamang katotohanan lamang ang ating mga sinasabi o sinusulat sa ating documentations. And then we have the accurate, yung accuracy ng ating documentations, the completeness, the current, and organized. It should be in the documentations. Usually, pinag-usapan natin yung the word SMART. It should be S for specific, A, M is for measurable, A, it should be attainable, R, it should be realistic, and C is for time-bound. So, dapat yan yung ating pinag-uusapan in terms of the quality documentations. Next one, there are different methods of documentations. The first one, methods for documentations, that is for a narrative. So, narrative that is traditionally used to record patient assessment and nursing care provided. So, traditionally used, yan yung tatandaan natin to record patient assessment and nursing care provided. Okay, so in a narrative that is a traditional part of the source-oriented record, it consists written notes that includes the routine care, the normal findings, and the client's problem. Okay, let's proceed to the problem-oriented medical records or yung tinatawag natin sa abbreviation na POMR. So, This system of organizing documentations to place the primary focus on the patient's individual problems. So, the advantage of the problem-oriented medical record is that encourage collaborations, and the problem list in the front of the charts alerts caregiver to the client's need and make it easier to track the status of each problem. Ang disadvantage lang naman mga anak of this POMR, the caregivers differ in their ability to use the required charting format. It takes constant vigilance to maintain an up-to-date problem list, and it is somewhat inefficient because assessment interventions that apply to more than one problem must be replaced. Okay? We have database. In a database that is contain all available assessment information pertaining to a patient. Database consists of all the information known about the clients first entered the healthcare agency. So it includes the history, the physical examination, nursing admission assessment, ongoing assessment, PT assessment, laboratory reports, and radiological tests. We have also the problem list. In a problem list that includes patient physiological, psychological, social, cultural, spiritual, developmental, and environmental needs. In a problem list that is derived from the database, it is usually kept at the front of the chart as an index to the numbered entries in the progress note. So the problems are listed in order in which they are identified and others are resolved. Okay, care plan. In a care plan, that is the initial list of orders of plan of care is made with the reference of the active problem. So care plans are generated by the individuals who list the problem. And then we have the progress notes. In a progress notes, healthcare team members monitor and record the progress made toward resolving patient's problem. So in POMR or SOAP, is a chart entry made by the healthcare professional involved in a client care. They all use the same type of sheet for the notes. So progress note are used the same type of the sheet notes. Okay, punta tayo sa progress note, which is the SOPHIER. S is stand for subjective data, O is for the objective data, A is for assessment, P is for planning, I is for intervention, E is for evaluations, and R is for revisions. In subjective, that is consists of informations obtained from the client says. So in subjective, it describes the client's perceptions of and experience with the problem. So subjective data are included only when it is important and relevant to the problem. Okay? In objective data, that is consists of informations that is measured or observed by the use of the senses. So for example, vital sign, laboratory, and X-ray result. In assessment, that is the interpretations or conclusions drawn about the subjective and objective data. So during the initial assessment, the problem list is created from the database. So A entry should be assessed statement of the problem. Okay? And plan is a care designed to resolve the stated problem. So the initial plan is written by the staff member who enters the problem into the record. And next one, we have the interventions. So in the intervention, that is referred to the specific interventions that have actually been performed by our caregivers. And E is for evaluations, that is includes the client responses to the nursing interventions and medical treatment. So this is the primarily reassessment data for evaluations. And lastly, we have the revisions, that is reflect care modifications suggested by the evaluation. So these changes may be made in the desired outcome, interventions, or target date. Next one, we have the focus charting. When we say focus charting, that is intended to make the client and client concern and strength of the focus of care. Kung kanina pinag-usapan natin in the progress note that is software, right now sa focus charting naman, ang gagamitin lang natin is DAR. D is for data, A is for actions, and R is response or referred. So, in a data that is reflect the assessment of the phase of the nursing process and consists of observations of a client's status and behavior, including the data from the flow chart. So here we have the vital sign, pupil reactivity. So the nurse record both subjective and objective in these sections. Okay, and we have the actions. In action reflects planning and implementations and includes immediate and future nursing actions. In action, it may also include any changes to the plan of care. And the response and refer that is reflects the evaluation phase of the nursing process and describe the client's response to any nursing and medical care. Okay, we have the common record keeping forms. We have the admissions nursing history form, the flow sheet which has a graphic record, intake and output record, medication administration record. We have patient's care summary, standardized care plan, Cardex, and we have the discharge summary form. In admission nursing form, that is a comprehensive admissions assessment, also referred to us as initial database. Nursing history or nursing assessment is completed when the client is admitted to the nursing unit. So this form can be organized according to the health pattern, body system, functional abilities, health problems and risks, nursing model, or type of healthcare setting. In a flow sheet, we have the graphic record. That is a flow sheet enable nurses to record nursing data quickly and concisely and provides an easy-to-read record of the client's condition over time. Okay? So pag sinabi natin graphic record, this is a record typically indicates the body temperature, the pulse, the respiratory rate, and the blood pressure, weight. In some agencies, other significant clinical data such as admission or post-operative day, bowel movement, appetite, and activity. In intake and output record naman, all routes of fluids and intake and all routes of fluid loss or output are measured and recorded on this form. In a medical admission record, that is a medication flow sheet, usually include the designated areas for the date of the medicine order, expiration date, the medication name, dose, the frequency of administration, and route, and the nurse signature. And we have the patient care summary. And then we have the standardized care plan were developed to save documents time. Display may be based on the institution's standard of practice, thereby helping to provide a high quality of nursing care. And Cardex. Yung Cardex naman, that is a widely used, concise method of organizing and recording data about the client, making information quickly accessible to all healthcare professionals. So, system consists of a series of cards kept in a portable index file or on computer-generated form. And then the discharge summary form, that is all the discharge summaries of our patients. And then documenting communications with provider unique events. So we have in documenting, we have the telephone calls, telephone or verbal orders. So sa telephone orders natin, occur when a healthcare provider gives the therapeutic order over the phone to a registered nurse. While in a verbal orders, that occurs when the healthcare provider gives therapeutic order to RN while they are standing in a proximity to one another. And then we have the incident reports, any events that is now consistent with the routine expected care of patient or the standard procedure in a place on a healthcare units. Okay, for your activity, please answer your book on the test on knowledge, page 279 to 280. So we have 1 to 10 items. Again, take a picture of your answer and submit your answer in the Google Classroom before 12 noon. So, thank you and God bless. Ingat kayo mga anak.